Welcome back. This is the fourth video in our September series on functional behavior assessment. And so in this video, we're talking about what exactly is an FBA. So we've talked about functional behavior assessment, but what is an FBA? So an FBA just stands for functional behavior assessment. And an FBA is typically done by some kind of professional trained in behavior analysis. So maybe a BCBA, which is a board certified behavior analyst. They may conduct an FBA. Behavior specialist in the school. This is somebody who doesn't necessarily have a certificate in behavior analysis. They may have specialized training in conducting behavior analysis in the school, and so maybe a behavior specialist. A school psychologist is also someone who might conduct an FBA. And so what exactly is an FBA? An FBA is a way of assessing behavior. A lot of times they assess what's happening immediately before, what is the behavior, what's happening immediately after, but it's really designed to get at what the underlying function of the behavior is, because again, we don't want to treat just the topography of the behavior. We don't want to just say they're throwing a tantrum, but we really want to look at what is that function. Especially in the school setting. Let's say perhaps they're throwing a tantrum. If they get sent home from school when they throw really big tantrums, well, if the function of their behavior is escape and they're trying to get out of school, is being sent home, is school suspension, or is being sent home early from school an appropriate intervention? It may not be. And so that's why it's important to look at the function of the behavior before you develop an intervention. And so that's what it's doing. When are they conducted? Typically, they're conducted as part of an IEP process whenever a child's having specific behavior problems, especially if the child's being sent home from school, if a child is being suspended from school, if the child has a disability related to behavior, you might get an FBA. Or have a request to complete an FBA. If the behavior is not getting better, so maybe they were put on a behavior intervention, but the behavior continues to persist and it's not improving, that's another circumstance where you may find that you're requesting an FBA. In the treatment setting, if your child is receiving ABA treatment, they're receiving FBAs as part of their treatment plan and as part of their treatment. In behavior intervention or counseling, depending on the theoretical orientation of the counselor or the therapist that's working with their child, they may be conducting an FBA to determine what the function of their behavior is before they recommend you do a specific treatment at home. Where are they conducted? A lot of times FBAs are conducted in their natural setting or by interview or data that's collected from the natural setting. They typically are conducted at schools. They may be conducted through therapy. So that's kind of when they're conducted. Some people may have heard of an FA or a functional analysis. So what's the difference between an FBA and an FA? If you've heard of functional analysis before, functional analysis is a very specialized technique or assessment procedure for determining the function. So an FBA is a hypothesis. So we don't necessarily know definitively what the function of the behavior is. This is our best hypothesis based on the data that we've collected. Whereas an FA is an experimental procedure where they're testing out conditions. And so they're actually testing what is the function. So it's a little more definitive. It's kind of the difference between correlational research and causation or experimental studies. So it's a little bit of FBAs or hypotheses, and they're more correlational, whereas an FA is more definitive in that experimental side of things. And typically those are conducted by BCBAs or someone with very specialized training. Very rarely would you see an FA in a school setting that wasn't conducted by a BCBA. But you would often see an FA conducted in an ABA program. Or a specialized treatment program. So what exactly is the ABCs that people keep talking about in these ABC logs? ABC stands for antecedent, behavior, and consequence. So in an FBA, you are analyzing the antecedents, what is happening immediately before the behavior occurs. What is the behavior, the topography of the behavior? That's when it's appropriate to look at the topography of the behavior. And what is the consequence? So just like with function and behavior, you don't want to imply or infer emotion in your ABCs either. So you tend to leave emotion out of it, and we're just focused on what those functions are. So the antecedents, you're describing where the behavior occurred. You're describing when the behavior occurred. You're describing who was present before, what was asked of the student before. You're describing the environmental conditions right before. So you're not describing the internal conditions, but the external conditions. So what was happening in the child's environment right before? Antecedent is just a fancy term for immediately before. So what was happening immediately before the behavior occurred? What were the potential triggers? And again, not focusing on internal factors, but focusing on the external environment. Who, what, where, when, and not focusing on why. We're just stating the facts that we have. It's very objective. It's very fact-based. We were in the cafeteria. It was during lunchtime. All of the students were talking. So what was occurring immediately before? What was the behavior? So again, very objective, not internal, but external things that you can see. So the student laid on the ground, they yelled, they screamed, they called students' names. What were the exact behaviors? What could you see? And then your consequences, again, not what you feel the consequences were, not what you intended the consequences to be, but what were the potential consequences. So as a behavior analyst, I'm looking, did you negotiate with the child? Did you provide reprimands? Did you verbally reprimand? Did you physically reprimand? Did you redirect? Did you guide the student? All of those are things that we're trying to do, but could they have been attention? So could they have been linked to increased attention? Was the student removed from the setting? Was the student, was the task demand reduced? Was the student sent home or suspended? All of those, again, are consequences that could be maintaining the problem behavior. Was the student allowed to access a sensory break? Was the student allowed to walk in the hall? Was the student allowed to go work on a different activity? Because all of those could be tangible things. And so in that ABC, you're looking at what's happening right before, what is the behavior, and what is the consequence. But it's very important not to look at what is your impression or what is going on internally, but what can you see externally that's happening in the environment.